Hi, everybody. Thanks so much for joining us today for our webinar. We are talking about the COVID vaccine being here and now what. I think we've got a pretty diverse audience. People are still logging in. We've got a couple of minutes of housekeeping items. So hopefully by the time we get there, everybody will be here and logged in. As I said, we do have a pretty diverse audience today. And I think some of you may be in larger facilities where you're actually distributing the vaccine already. Some of you, I think, are in smaller practices where maybe you're trying to figure out what's coming. Hopefully, we'll be able to, kind of get some information out there for all of you that you'll find helpful. I am going to do a little poll here in a minute just to get a better sense of where some of you are. But first, I just wanted to say today's webinar is sponsored by SR Health. We'd love to encourage you to follow us on social media and stay connected with us. It's a great way to kind of stay up on the latest education that we're producing, information and education coming from other thought leaders, best practices, events like this one. So if you're someone who is active on any of these channels, please consider following us. Also a great way, if you have follow-up questions, it's a great way to connect with us easily, that is not email or phone. So today we'd love for you to ask questions as we're going along. If it seems particularly appropriate in the moment, we'll try to answer it then. Otherwise, we'll make sure there's some time at the end to try to address as many questions as possible. Just click on the little arrow next to the word questions on your toolbar, and that will open. You can enter your question. This is also a good place if you're having any technical issues. We'll try to help you behind the scenes. Couple common questions that usually come up. This session is approved for PACOM CEUs, and PACOM CEUs are transferable to some other organizations. So at the end of the session today, we'll give you that code for PACOM. Also, there's an option in the survey at the end to say yes to receiving a PACOM certificate. Another common thing that comes up is sometimes people use their computer audio and have problems with their sound. If that happens, click on the arrow next to the audio option on your toolbar and switch from computer to phone and dial in. That usually addresses any sound problems that people are having. The deck for today is saved as a PDF and in the handouts. If you would like to download that, you're welcome to do so. We'll also be sending out the slides and the recording afterwards. So you will receive an email later today or tomorrow with all of that in there. So today I'm joined by two people who I think will be able to provide a lot of great content and education and really help you understand what is going on with the rollout of the vaccine and how they are communicating with their patients, educating their patients, preparing their staff, obviously getting their own staff vaccinated, as well as running larger vaccine rollout programs. So the first is Cindy Williams. She's the Vice President and Chief Pharmacy Officer at Riverside Health System. You can see from her bio here, she has been involved in a lot of programs sort of across Virginia. She's heavily involved in the rollout of the vaccine, not only in her own health system, but across the state. So she's really kind of in it right now. And I have to say, I appreciate her being able to take the time to come and speak with us today, because I know she is incredibly busy in trying to get that vaccine rolled out. And as in her role as Chief Pharmacy Officer, she obviously is seeing all of the latest updates and information. She's dealing with a lot of the logistics as well as patient communications and how this is being rolled out in different types of facilities. So we're lucky to have her here today. And then Cindy and I are also joined by Leslie Baker, who brings a huge amount of patient experience and patient communication skill and history to come speak with us. She's actually been on webinars with me before where we have talked about sort of patient experience, patient communication, patient access. She leads a number of different initiatives and programs in terms of kind of education and marketing, not just around the COVID vaccine, but kind of patient experience in general. And you can see that she also has many years of experience. She has not only worked with us in the past, but has worked with MGMA and HIMSS and the Barrel Institute, been a member, been a speaker, co-presented with us and with other vendors about different solutions and how to really improve the patient experience. So I'm excited to have Leslie here to talk to us a little bit about some of the campaigns that they've run and her perspective on some of the best practiced approaches to really making sure we can get as many patients in and vaccinated as possible. So we'll be really having kind of an open forum discussion here with Leslie and Cindy. And so, you know, again, your questions are welcome, and please make sure you enter those in as we go along. So we do have a little bit of a guide here in our deck today, just to make sure we touch on some of the key things we know everybody's thinking about. So talking a little bit about kind of the rollout of the vaccine, the structure of that, and what that looks like. And then talking about a few of the challenges that we are already seeing in the rollout, and then talking about some best practices around patient communication, education, addressing vaccine hesitancy, how can we do a better job of making sure people show up for both doses, some of those kinds of things. So before we get started, as I mentioned, I did want to push out a quick poll, which I'm going to do right now, just to get a sense of where you all are feeling you are in terms of what is your biggest challenge right now. Is it, you know, is it your own sort of internal logistics and figuring out how you're going to roll this out and get patients in? Is it actually getting the vaccine or getting patients to schedule? You know, in some communities, there's a much higher rate of vaccine hesitancy than in other communities, and that's a real challenge for some folks. I'm hearing a lot of people in community health centers saying that they're very concerned about how are we going to get these patients to actually get in and get the vaccine. So give everybody maybe another couple of seconds, and then we'll close that and share that out. Okay, here we go. I'm going to close it. So clearly, I'm going to share this. Clearly, getting the vaccines is the biggest problem, and I think that's something we can talk with Cindy about today around, you know, what is happening. She's facing some challenges around vaccines, getting them to the right places, into the right hands, to get them into the right arms. But I think we can see here that it's really the next two things are almost equal between sort of those internal logistics, workflow type logistics, right? And getting patients to actually schedule and show up. So we do have some tips and suggestions for a couple of those things too. Okay, I'm gonna hide that and bring us back to our deck here. Okay, and there we go. Everything looks good. Okay, so Cindy, I've been seeing a lot of people having questions and concerns about this, and so let's make sure everybody's kind of on the same page about the fact that we have two vaccines that are currently approved under this emergency authorization. Both of those are the mRNA and have about a 95% effectiveness. They both require 2 doses. I think there's some confusion. I've seen some people being confused about why can't kids get them, you know, which one requires medical grade freezers, those kinds of things. And then we have some more vaccines coming, which we'll talk about in a minute. But can you chat just a little bit about some of the challenges here around managing these two in particular?
Yeah, so, and I will preface this by saying up until, I guess, a week or so ago, most of my experience had been focused on getting vaccines and arms for those in phase 1A. So we are a fairly large regional health system. We've got roughly 10,000 employees. So, you know, that obviously was on our radar, but we also supported our community with about a third of our vaccines administered to frontline healthcare workers being for those outside of our organization. So you're right, both of these vaccines have some complexities, and we do think as we move forward, future vaccines will help us. You know, first is the cold storage. And so, you know, even though the Moderna doesn't require medical grade freezers, it does still have, you know, storage limitations. So the Pfizer vaccine does require that medical grade freezer, so down to -70 Celsius. Our health system did invest in those freezers, and so we've had an advantage from that perspective. The challenge still becomes, though, because we're doing a lot of hub and spoke to cover our geography, is that once those vaccines are removed from the freezer and placed under refrigeration, you have exactly 120 hours to use them. And then once they're actually compounded, because the Pfizer does require reconstitution, you have 6 hours to use it. So a lot of work and logistical planning, especially when you're scheduling, for example, clinics on a Monday and the location's closed over the weekend, you're shipping the Friday before, and all of that movement, a lot of logistical. The Moderna is a little bit friendlier. It just requires standard medication freezer temperatures. It does allow for refrigeration up to 30 days. But again, once you puncture that vial, it has to be used in 6 hours. So I would say neither of these vaccines are particularly friendly when you start talking about things other than mass vaccination or focused vaccination efforts. So for example, we've got a number of rural-based primary care locations. It isn't as if you can just say, when patients come in today, I'll start giving them Moderna, because, we certainly don't want to waste a dose. You've got 6 hours from when you puncture the vial, and you've got 10 doses in a vial. So it just brings up a lot of logistical complexities for how you're scheduling your events, how you're weaving them into the practice settings, which we did start doing for our patients 65 years and older, starting about 10 days ago. And then the follow-on doses. So, both of these require a second dose. The Pfizer at 21 days plus or minus 4 days, the Moderna 28 days plus or minus 4 days. And so as you're planning those events, you have to look at the stacking impact that you're going to have 21 and 28 days down the road. So for example, the first Saturday that we were open to phase 1B and could start vaccinating our primary care patients, we had one clinic that that administered 500 doses. Well, that now is going to come up for their second dose next weekend. They'd like to also add 500 more patients to the panel. So now all of a sudden they're not planning for an event of 500 patients. They're planning for an event of 1,000 patients. And then you've got the first dose, second dose. How do you keep those patients identified separately to know which ones you need to schedule a second dose? So both of these vaccines do come with some logistical complexities. And then to your question around the younger populations, there was a lot of discussion as the advisory committee for immunization practices met around the Pfizer vaccine. In fact, those that voted against moving forward with the vaccine was because of the 16 age and older. They really wanted that to be 18 based on the data or the limited data in those under 18. Moderna just went forward with 18 and up. It hasn't caused much of a problem for us to this point because we've been focused on frontline healthcare workers and those and older populations. But there's actually an advisory committee on immunization practices meeting being held concurrently with this webinar. Part of the discussion this morning was around looking at the data to this point around both the Pfizer and Moderna vaccines, as well as looking forward with the AstraZeneca Oxford vaccine, and specifically discussions around adolescent and pediatrics. And so I do think we will see more information on those groups within the next, I would say, 60 to 90 days.
Yeah, so that said, so what I'm hearing, so I'll share with the group here that I have a chronic condition and take a medication, and I hadn't quite realized how complex the scenarios could be. Some people I know are on certain types of treatments where they're being told to wait until the AstraZeneca or one of the others is approved for use later because of some concerns about people with certain types of diseases on certain types of medications, maybe not being a great fit for those mRNA vaccines. So what are you hearing right now, given that a lot of people are thinking I'm waiting, or I have a child with a condition and we'd like to get them vaccinated, but they're telling us no. What do you think the timeline is for some of these other more like vector-based or attenuated vaccines from AstraZeneca and Johnson & Johnson?
Yeah, what we're hearing is that we think Johnson & Johnson will provide their preliminary data to the FDA for consideration, possibly as soon as this week. I mean, I think it's more than likely going to be next week. And then the FDA will need to review that. They will need to set up their public hearings. Then the advisory committee on immunization practices needs to meet. So I would expect from the time the data is submitted, we're still talking several weeks before an emergency use authorization is approved. But I do think that that will happen in February. With the AstraZeneca Oxford product, I think many on the phone are probably aware that the clinical trials in the US were paused for about a month back in the fall because of an atypical side effect that was identified over in the UK. That pushed their trials back for recruiting somewhat. And so they are just starting or in the process of administering the second doses, because that is a 2-dose. AstraZeneca is a 2-dose series. The Johnson & Johnson is a 1-dose series. Both are storage under refrigeration. But the AstraZeneca product, because it is a 2-dose series, they now are just in the process for the US-based clinical trial with administering that second dose. And then based on the FDA requirements, there's a washout period after that second dose where they're having to look at side effects. And so I don't anticipate that they will be prepared to bring data to the FDA until sometime late February, early March, and then you've got that lag. So I would expect that we may see the AstraZeneca Oxford product approved sometime mid to late March. So I think as we come out of this quarter, we will certainly be in a better place. I don't have as much information on the current timeline for Novavax, because I do think J&J and AstraZeneca will be the next two that we will see come to market.
Okay. So kind of moving on, and we've already gotten some questions about this, and we're not even here yet. The CDC has sort of provided their recommendation about what the rollout should look like. And obviously, I think we all know at this point that every state is sort of doing this in a slightly different way, even down at the county level. I think in some places it's slightly different depending on the resources and what's happening in their own community. So, and I know that you guys have already done phase 1A and moved on to phase 1B. And the first question we got actually was from someone saying, what were some of the strategies that you used to move so quickly and get that phase 1A period finished? What did you do that you think you did right that made that go so fast?
Yeah, so I think it's a mixed bag, and I think you're right. It varies even within locations within states, and the approach that the states have taken. You know, I can specifically talk about Virginia because that's where I'm located. In Virginia, they really almost assigned a lot of phase 1A to health systems, and there was, you know, I'll be honest, there was a lot of angst because, you know, at the same time, we were being asked not only to vaccinate our own healthcare personnel, we were being asked to vaccinate healthcare personnel from outside of our organization, which you know, causes complexity just depending on how you're going to be reporting the data to the, you know, to the VIS. So for our health system, we're using our electronic health record, and so, you know, we made the decision to import our 10,000 employees into our electronic health record, use a very slick, streamlined immunization clinic process, which works really well if you've got an encounter within our EHR. But if you're an external party, you know, unaffiliated, you know, name the practice, you know, EMS providers, for example, a portion of them may have an encounter within our EHR, but many of them don't. And so, you know, we faced a lot of complexity. I mean, we've got a central scheduling team because not in addition to hospitals, we've got, you know, roughly 600 physicians. We've got 9 nursing homes. So we've got central scheduling that does scheduling for our medical group anyway. And so they took this load on, which was a pretty tremendous load to do a lot of manual scheduling. But I think there was a real push, at least in Virginia and in our region, by the local health systems in collaboration with whatever capacity the local health departments. I will tell you, even though we're officially in 1B, there are still people in 1A that still have not been vaccinated. We're still bringing folks in as recent as, you know, this week from outside of our organization to try to get as many shots in arms for 1A. As a state, we're also working through the long-term care facilities. Our state decided to go with the long-term care pharmacy partnership, and our facilities joined in with that, which did take some burden off of our own hospitals to be able to provide, you know, vaccines. And we are now getting second doses administered for those residents in our nursing home, assisted living, independent livings. But for example, my parents live in an independent living with wraparound services in Virginia, and they haven't gotten their first dose yet. So even though the state has said we've moved into 1B, I would say there's still some 1A, but I think, we got to what we considered as a state to be somewhat critical mass. And, our health system felt like we were ready. We've got, again, a very large primary care network to start working on phase 1B. So 1B, one of the complexities, and some in the call may recognize this from your own states, is, the initial recommendations from CDC was we would start with 1B would be 75 and older, and 1C would essentially be 65 and older, and those 16 to 64 with underlying medical conditions. So that was how we all, as well as frontline essential workers. So that was how we all planned. That's how the state of Virginia approved things. And then I guess it was 2 weeks ago, HHS announced that they were going to change that stance. And I will tell you, because I listened to the ACIP committee meeting where they decided on 1B and 1C, and there was a lot of conversation about should we not include people 65 and older. And I think the fear at the time from ACIP, and I think it's what we're seeing today, is we don't disagree, but the supply is far less than the demand. And so I can tell you in Virginia what happened when they rolled 65 and older and 16 and 64 with underlying medical conditions in 1B, that population in the state went from 1.5 million to 4 million. So almost tripled the number of people in that group. And I think where we see ourselves, at least in our state, is that now we've got this tremendous demand, but our supply at the federal level is basically staying flat for the next X number of weeks at 106,000 a week. And so when you think about 4 million people and you know that you're getting 106,000 doses per week, that's going to take a really long time to get through that group. Certainly not going to get to the doses that we're aiming for as a country until we've got more vaccines. So, that's really where we are right now. And I think it is a mixed bag. And I think we will continue to see 1A sort of woven in with 1B. But I do think, at least in our health system, since we've been open up to 1B and we've been able to now, start pushing out through our primary care practices, our vaccination administration rate has almost tripled because we just have so many more points of access than we did when we were doing our healthcare personnel on the campuses of our hospitals.
Yeah, and I want to ask Leslie a question because she's seeing it from the flip side. But before that, I will say, I'm in Montana, which is by population one of the smallest states, and so getting a very small amount of vaccine because it's sort of a per capita distribution. And we are seeing a huge struggle with this change in 1B because there are a lot of people age 65 and older and a lot of people with underlying conditions in a very small state that's actually not getting a lot of vaccine doses right now. And no one seems to know when those doses will be coming. But I want to ask Leslie from the flip side in regards to this question about, how did you get your staff vaccinated? I know you really had some frustration around, she's smiling, real frustrations around trying to figure out how to get your staff vaccinated since you guys weren't providing the vaccines and they needed to go elsewhere initially to get them. So can you share some of the things that you did to try to get information, get your staff vaccinated and move through that 1A, not being a health system providing vaccines?
Yeah, I can say I have vaccine envy of Cindy, but we had a hashtag left behind on the front line. So we have 30 something practices, predominantly pediatricians, and we are not attached to a hospital system. We're an independent organization. And so I think our CEO said it best in one of the news pieces with like an underground, us trying to get information. There was no transparency. We're in the state of New York. And to Cindy's point, a lot of people in that vaccination population and not enough vaccine anyways, even if you think about just the healthcare workers. So it was very complex to try to figure out where to send our people to get their vaccine. We have now started to get our people vaccinated, so I'm very thankful for that. But I guess as far as some of the ways that we tackled that, because I think it even patient communications, but we petitioned and we got our patients' voice involved, and we want to be vaccinated too, and take care of your children, and lead our case. And the news stations picked it up. We did a lot of PR campaigns around it, and I guess the squeaky wheel a little bit for that, but also I think it's important for the public to see their doctors getting this vaccination, because to some of those concerns about is it safe or what have you, if they're seeing their doctors lining up first to get it, that really helps with some of that vaccine hesitancy and fear factor.
Yeah. And I honestly think, you said sort of the squeaky wheel. I think there's so many complexities to rolling out the vaccine that if you don't have a lot of squeaky wheels with people saying like we're not getting the information, or we don't know where to go, or if you don't have people out there sort of advocating, then we won't know what the problems are and be able to try to fix them and sort through them as we move forward, right? So so I think what I would say is follow Leslie's advice and be a squeaky wheel. If you're struggling to get your staff, get everybody vaccinated and move through this process, keep pushing on your contacts at different facilities or with the health department. I think those health department relationships have never been more important than they are now. We see it in my own community. The physician who's the head of our health department is doing Facebook Lives like every week, and she's there with her partners from our local hospital and from the local school, and everybody's trying to, it's the more you can coordinate and advocate, I think the better.
Well, and I think the reality, if I could just add to one thing related to that is, I think the reality, I can only speak for Virginia, but I think, you hear this federally as well. It's not that we didn't know this was coming. It's not that we didn't know this was going to be complex, but there was really no funding provided to build the infrastructure for the local health departments to be successful in rolling these vaccines out in mass scale. And I think, the fact, and everything's going to have to be done to a certain degree locally, but there wasn't really a very good, I think, federal plan for this, nor federal funding. And I know our local health departments, and we do have a very close relationship. Our health system bridges 4 health districts in the state. And we have, for months in our COVID response, we have the local health district physicians and leadership folks on our weekly health system huddles around COVID-19 generally, whether it's testing, whether it's surges, whatever the issue is. But, with vaccine, we started doing additional meetings. And in fact, I had a meeting earlier today with the lead physicians for that cover the 4 health districts. I think you're right. Those relationships are critical. I would say the other thing about being a squeaky wheel is you just never know when that information, might become helpful. I sit on one of my other things that I do in our communities is around the opioid epidemic. And I sit on a community-based group that really looks at how we work, across, whether it's the United Way, whether it's the Community Services Board, whatever, about how we deal with the opioid epidemic. And I was broke away from my vaccine planning a couple weeks ago. I had an hour break. It was the monthly call, so I joined in, and they asked me for an update on what was going on with vaccines. And our local Community Services Board, which has, hundreds of employees that are really our safety net for behavioral health services in our community, they weren't even aware that they were eligible to get the vaccine. They knew they were in the bottom group for 1A and didn't know their number had been called because they weren't being the squeaky wheel. And I'm like, oh my gosh, this is something we can help with. So we immediately got the names of roughly 300 people in their organization that wanted to get vaccines. And we expanded access in our clinics. And the last of those individuals is getting vaccinated this Saturday. So I think sometimes it is, those personal relationships, if a health system or other provider that maybe have vaccine. The other thing is we redistributed to a number of our competing physician practices. If we had vaccine and they were registered with the CDC and had their provider agreements in place, we sent them vaccine and they administered their own team because our goal is to get as many people vaccinated as possible in the shortest period of time.
I would also add to that that we're seeing a lot of health systems doing a really good job of being very active on social media about, when they're doing clinics, who can be getting vaccinated, what. If you are not following and connected with your local health systems on social media, now would be a good time to consider doing that too. Like I know here in Montana, where the Billings Clinic is the largest, tertiary care provider in the region, not just for Montana, but for Wyoming and parts of Idaho as well. They've been incredibly aggressive about their campaign around trying to get first responders and other providers who are not in their system scheduled into these clinics. And that brings me to kind of this issue of the logistics around the scheduling, the communicating, the surveying. I've talked to both of you guys about this, that, we'll hit on vaccine hesitancy a little bit here in a minute. But even from a planning perspective, whether you're trying to address the hesitancy issue with education, or you're trying to plan for doing clinics or scheduling patients, never have we really seen more that we're needing to do like sort of surveys with groups of patients to find out where they are in this process. We're trying to identify them and group them, and then trying to communicate back out based on the information that we're getting. So I think both of you have said, like trying to sort of survey patients and get a feel for who's going to be ready, or who wants it, or where there's hesitancy issues. That's been a helpful thing in trying to move through your planning, correct?
Yeah, I mean, I can certainly speak to what we've done, and then let Leslie. So we started with our own team members because that in essence is somewhat of a representation of our population. I mean, we've got an ethnic mix, within our own health system. We've got urban hospitals, suburban hospitals, and rural hospitals. So we started surveying early on. I think we sent our first survey out in October, probably late September actually, before we really knew about the vaccine efficacy for the Moderna and the Pfizer, and asked, are you willing, are you not willing, or are you unsure? And we did require that if you were unsure that you gave us, what information would you need to make a decision? And the majority of folks said it's really the safety and efficacy piece. And so we knew early on that had to be some of our messaging. So our early survey only had 28% saying they were right then willing to get the vaccine, and about 35% being on the fence, and about 35% saying, yeah, really not interested, 37% really not interested. So once the information came out with the initial for Pfizer and showing 95% roughly vaccine efficacy rate, we did the survey, because now we're using this information not for how we need to message our team members as well as our more global community, but now we're really looking at how do we plan for these mass vaccination events for our team members. And so by that point, because we did have the vaccine efficacy information out, there had been somewhat of a shift. We'd also been doing a lot of education of our team members as well as our community in the meantime. And so that survey, which was launched in, I guess it was mid-November, came back with 60% willing to get the vaccine of our team members. And we've ended up, I think right now we're sitting at about 63%. So we've used some of those assumptions as we've moved forward, but I will tell you the other sort of population that we surveyed that's been helpful as we've started to roll out to 1B are the populations within our nursing homes and our assisted living and independent livings, because that's a very different group, because we are certainly finding in our own employees that it's the younger group that has less vaccine uptake than it is those that are in older populations. We are seeing a very high acceptance rate in general in our older groups, and in the nursing home, assisted living, independent living group, we're seeing more like 80% acceptance rate in most cases. And so I think doing that surveying has helped us with some of our assumptions when we're planning for opening up to larger groups.
So Leslie, I want to hear what your thoughts are on that, but also you're in the unique position, even though your pediatric facilities won't be getting this vaccine probably till much later in the year, you guys deal with vaccine hesitancy all the time, and are constantly having to do work around how to understand people's issues and education. So don't just talk about your thoughts about COVID, but talk about some of the strategies you've used around this issue overall, because you've got a lot of experience there.
It's a terrible joke, but I say it often. Because we're in New York, I said all we needed was a good measles outbreak to get over vaccine hesitancy. So, I will say that, our organization, that's always been on our quality measures and something that's been very critical to us in making sure that patients are educated and understand to overcome that vaccine hesitancy. And really, it does come down to trusted information, trusted source. Because even the COVID vaccine, once you understand the technology that was put behind these vaccines and the amount of that, none of the testing was short-sighted. I mean, Cindy can correct me if I'm wrong, but from my understanding that, the same amount of testing was there, you realize all this, then you start to, you trust when data is there and processes are there and your doctor, as your trusted pediatrician, is telling you that it's safe. That really kind of helps overcome most of that vaccine hesitancy. But we do a lot of education and prepping the patient. So what to expect on your visit. We send that out as a pre-visit text message so that the caretakers can look at, what that child is getting for a vaccine and read all about it before they even come. But it's information coming from us versus the World Wide Web of all kinds of doctors. So I think it's really just giving your patient the source to go to. That's been what's beneficial to us.
And I think that's an important point. We've been saying kind of all along, and we'll move over and I'll talk about a couple of data points here around specifically patient communication. What we've been saying since back in March and April is healthcare providers are in a unique position to actually be the ones sending out information to patients. No one else really can do that. Everyone else is trying to draw people in with information that is on the internet. Whereas your provider can actually send you text and email messages with details and education and information. And this whole idea, like you have done, Leslie, around trying to position yourself as being that trusted source of information and having really regular, consistent communication has been hugely helpful to some organizations. And it just happens that back in January last year, we had been conducting a survey specifically around patient communication, and we were just about to release the data when COVID hit. And so we sort of pulled back and said, well, this may not be relevant now, that things could totally change in the next couple of months. So we waited and we reran the survey in May and June. And that gave us kind of a comparison of how people's feelings about, healthcare in general and communication in particular had changed during this pandemic period, knowing that people were going to need to be pushing out huge amounts of messages about changing appointments, canceling appointments, switching to telehealth, testing, new protocols, park and wait stuff, all these kinds of issues. And what we did see was, one, that patient satisfaction dropped by about 7% in that period of time, because people felt kind of frustrated that they were struggling to get information in a timely way. But on the flip side, that interest in phone calls went way down by close to 15%. And interest in digital communication, like Leslie's saying, sending out text messages with information pre-visit or doing your reminders or your surveys or whatever, through text and email, that an interest in that continued to go up. And that's been on the rise for quite some time. So one thing we've definitely learned, not just from our research, but from research that's been done by other people as well, is that automated and digital communication is even more preferable now than it ever was before. And as healthcare providers, you're in a unique position to deliver, really accurate information through text and email to patients, and they are highly likely to open it. Past research that we have done has shown that nearly 80% of patients would like to get information via text message from their doctor, especially things like reminders to schedule an appointment, reminders about an appointment that's already scheduled, visit instructions, those kinds of things. But almost the same number of people would like to be able to send a text message with a question or to address a concern or to get information. So we know people want that interactive experience, We also know that we can do a better job of getting people to both schedule and show up when we're using digital communications. And this is just sort of an example here when we looked at reminders that when they were done electronically using the right cadence, which we found to be about 3 weeks, 3 days, 3 hours, there was about 150% increase in patients confirming their appointments. So, just from another perspective, we know that these kinds of digital communications work. So in this conversation about logistics, when we're talking about, let's survey patients to see where we may need to do additional education, and then let's deliver education to help them be ready and understand the vaccine, and then let's make sure they can get to these 2 appointments and they know where to go and what to do if they do have an adverse reaction or they have a question. That these digital communications right now are seeing a much higher, there's a higher interest and a better rate of follow through. There is was another survey that said that text messages are about 200 times more likely to be responded to than a phone call. So there's really is a lot out there about that. And on that thing of reminders, so talking about the logistics, before we kind of get into some examples of communications, some things to consider that I just want to sort of throw out there is really, so first, obviously, email and text are definitely better. You want to have all the information that they need about the appointment, but you also do really want to have, like Leslie said, some of that other information that can really be helpful in getting people past any concerns or barriers that they have, or things like wayfinding and text messaging, what to do if, the things that can potentially be a barrier to somebody actually getting there and showing up. And we would strongly encourage, like Cindy was saying earlier, using your EHR, your practice management system, to actually schedule people in for the appointments for doing this. And I know some organizations have used, most hospitals and health systems obviously have a process because we do it every year, for flu shots. But it's less effective with this 2-dose process. So even if you're doing that, you probably want to schedule that second vaccine, right? Even if you're doing like somebody in your organization goes department by department and gives people vaccines, that's going to be very hard to do manually twice. So even with your staff, you may want to think about applying the same best practices we use with patients to your staff rollout if you need to do that. So talking about education, I do want to share and have Leslie and Cindy both talk a little bit about some of the campaigns that they've done, because I think some of them have been very effective. And then I want to make sure if you guys have more questions, that we have some time for that as well. So Cindy and Leslie, both of you work at organizations that have used video, not just for this, but for other things. And we get a lot of people asking about that. So Leslie, I would love to have you talk a little bit about, is it very hard to do videos and webinars and be able to use that as a tool with patients?
No, you have subject matter experts everywhere in your practice. So, we, just to talk a little bit about this particular screenshot you have here, when COVID hit, and to go back a little bit on that trusted source, we in healthcare assume that everybody knows what we know, and they absolutely do not. I mean, they know what they know because that they work in the banking industry, and we don't know anything about that. So, it's over communication is better, and it really helps with that fear factor. And COVID in itself brought a lot of fear to everyone, and a lot of information out there in the world. So we had a plan before COVID even hit about this, trusted pediatrician kind of mindset. But as soon as it did, we started identifying things that we felt like parents were asking us anyways. They were already it's funny, you say the phones weren't ringing, they ring even more, but we just identified those things and made webinars of them. And they came together so quickly because you have all the questions. So being able to put that information out there, and parents being able to attend and ask any other questions they had, it's been an ongoing great process for us for getting that education out. Also, I know a lot of doctors are scared of TikTok and other social medias, but some of our patients are there. So if we want to meet patients where they are, we have to get out of our comfort zones. But it doesn't mean that you as a physician has to go on TikTok if you don't want to. You could easily even have a patient, as long as please have photo consent and there are other things. But you could utilize anyone in your practice. And a cell phone, all of our smartphones have better cameras than you can almost buy for production. So, you know, it's real quick and fast and easy, and you upload it and you're done. So it's a way to get your message out quick and easy. Or, you know, if you wanted to go more into doing webinars, it's not hard. So there are a
Yeah,
few.
we're here doing one right now, and I would say that it was pretty easy to put together. And Cindy, you guys have similarly been doing some video like this one, where you've done some of the things we might push out to people in a text message or an email about FAQs or myth busting, or, you know, things the CDC wants you to know about the vaccines, or any of those kinds of things. And similarly, did you guys find it pretty easy to create this stuff and deliver it to patients?
Yeah, so we've taken a couple of different approaches, and sort of to build on, you know, what Leslie said. I think the questions that we're actually getting from our patients and our team members are great basis to develop your messaging, because that's what people want to know. So we have a nurse call center that has been in existence for many, many years at Riverside, and anybody from the public can call it. And so, you know, whether it was early in the pandemic and we were dealing with, you know, visitation or testing or other things, or whether it's now a lot around vaccine, you know, they get everything and anything, and you know, they collect those questions, and we use those to put together our FAQs that we can provide to all of our team members that are public facing, so that we've got a consistent message that's based in science. So that's something that our marketing team is just forever updating. I've been very involved as sort of the vaccine coordinator for the health system with a lot of that. But we've also put together, you know, very targeted either messaging like you see here. This happens to be one of my directors of pharmacy at our largest acute care facility. She's not only very knowledgeable about the vaccine, but she's also an individual of color. And so, you know, we try to do some very targeted messaging around the vaccine hesitancy, and bringing in individuals that, you know the science, have gotten the vaccine, why they got the vaccine. But another one of the things that we've done is we've done a tremendous number of community-facing Facebook Live events. Those are very easy to put on, you know, and you can easily have people social distance to do them. I know I've done a number. I've done several about vaccines. They're open to the public. You know, we do Q&As, and you know, we've done that since the beginning of COVID to get information out around the disease, around testing, and most recently around vaccine. And again, many of these are very easy to do. You can do them with tools you already have in your organization. You know, we then can post these on our Facebook page. You know, we can, you know, other social media outlets where folks can go in after the fact, watch them, and continue to send us questions that we do our best to answer.
Yeah, and I'll add to that. Like I was saying, I'm in a small town in Montana. I happen to know the doctor who is with the health department here, and I happen to know that she is not active on social media and is not a fan of anything modern in any way. And she has managed to very successfully do Facebook Lives and push out videos with very little additional help or support, really on her own. She's figured it out on her own. I mean, it is much easier, I think, than people think. So if you're not already doing some of those strategies, it is something you can put together very quickly with what you have on hand.
And I would also say, because there was a period of time back in right before Christmas where I felt like I was just on the ongoing interviewed for different things. You know, there's some of our rural communities that say, you know, we don't have a lot of people in our community, especially the older folks. They don't have smartphones, they don't have internet. And so I even did a number of radio interviews. I mean, you think about who does radio interviews anymore, but, you know, I think I did, you know, 5 or 6 radio interviews and a lot of written press interviews just to get the word out around the vaccine, you know, the facts around the vaccine, what people can expect, where to get answers to their questions, understanding that in some of our communities, social media may not be the only way to get to folks. It's probably a little bit different in New York where you're in a more metro area, but we've got a hospital on the Virginia Eastern Shore, which is segregated from the mainland Virginia by a 20+ mile bridge tunnel. That's a very rural, underserved, predominantly older population, and many of them don't have access to internet services. So I think it's getting the message out in a number of different mediums.
Yeah, absolutely. And I want to follow up in our last little section here. Both of you guys have also done, some great campaigns around trying, like we were talking about earlier, around showing providers getting their vaccines, showing staff getting their vaccines. And again, like Leslie was saying, really easy, as long as they're okay with having their picture taken.
Every single one of our doctors had whoever was giving them their shot, somebody in that room taking this picture for them. So
yeah, it's just shooting a picture. And like Leslie said too, with patients, something I used to do as well when I ran patient engagement and education for about 5 years for a small integrated health system, having those sign-off forms on hand, and patients come in, and if the staff know them, feel comfortable with it, saying like, hey, can I take a picture and post it or whatever. It's like there's a lot of ways you can kind of get that out there. And I think, so Leslie, tell us, because you guys did this hashtag IVAX4, and I think on the next one we might have your trusted source ones. You guys are pretty good at coming up with kind of campaigns and using hashtags. And that's not that hard
that's
either,
the marketing
right?
department. That's not me. But yeah. So it was. We have the one that there's also a hashtag. This is our shot, and then the IVAX4. So every time someone would get a vaccine, we would ask them, "What are you vaccinating? Who are you vaccinating for?" And so we would put their blurb of whatever they said with the photo. And just about social media in itself, photos and videos are going to always produce better results than just words on the screen. It's not engaging in any capacity, not to mention somebody may not read what you wrote. So always better to, if you have it in, I think that to that trusted source too, if a patient, like Cindy was talking about her director of pharmacy, they're knowledgeable, they can relate to that person, and that always helps. So it's a better way to get a message across. Otherwise, you're just telling people something, but not telling them it with meaning. So
yeah, and I think, like we've been discussing too, the issue around potentially surveying your patients, trying to get a sense, or talking to your nurses if you have nurse lines. We work with another hospital that actually set up an entirely virtual urgent care just to address COVID questions. And they use that kind of as their source. And trying to really be thoughtful about how, addressing those questions specifically, or addressing the concerns people, when you do that survey and you ask people if they're going to get it, and if they say no, why not? Right? Really thinking about that and thinking about who's delivering the message, so that you can be addressing that, like using someone who is both knowledgeable and a person of color in an area where maybe, vaccine hesitancy is 50 or 60%, because it is largely a community of color. You need to be thinking about those things as you try to address those concerns and issues, and move people kind of in the right direction. I've been hearing a lot, maybe you guys have too, people saying like, boy, when they rolled out the polio vaccine, everybody lined up and they just got it. Nobody asked any questions. And now here we are, many years later, people have really forgotten that there was a time when 30% of children who got polio died, and now we vaccinate, and people have a lot of unfounded, sort of ideas, fears, concerns. And there's a huge opportunity here to educate and bring people along. And again, as healthcare providers, you're in the unique position to do that in a way that nobody else can.
Leah, I was just going to say too, we have on our website, if anyone's interested in it, a video that our allergy and asthma doctor and a couple of our other doctors did about talking through the COVID vaccine. I mean, Cindy did a fantastic job. on this webinar, but there's it's patient friendly. You can share it to with anyone, but you know, or even if you wanted to listen to it and take some ideas and do one for your own patient community. But I think just let's buster those falsehoods out there.
Yeah, and all these examples for everyone who's on the call, and that's the reason we put them up here, really was to say, like, these are simple things you can do on your website, you know, on your social media pages. No one is trying to kind of usurp and be the owner of all COVID vaccine education. We want to get everybody using, you know, doing this in their own communities. If you're looking for templates, we actually have a COVID resource center. If you go to srhealth.com, there's a section called Patient Engagement HQ, and there's a whole section of templates in there. So if you're looking for templates, you can just copy and paste to send out text messages, emails, put on your website, your social media. We've got about 8 or 10 on there that have all kinds of FAQs, facts versus myths, information from the CDC. You know, I would encourage people to go, you know, check that stuff out. To wrap us up, and then I guess we'll do a couple quick questions, guys. I would love to have each of you say, like, what is the one thing you would encourage people to do to try to be successful in their vaccine rollout? So Cindy, I'll start with you. If you could give one piece of advice, what would it be?
Oh, wow, that's a tough one, because it's been a journey over the last 6 weeks. We will have administered it. It seems like a lot longer than that, but we will have administered about 20,000 first doses, I think, by the end of this week, with maybe 25,000, with probably 10,000 of those coming this week, as we've had a very big campaign. I mean, I think if you're talking about, I'll do it into 2 buckets. One will be sort of the patient outreach. The other will be sort of internal operations. I do think that, you know, regardless of what the vaccine is, there's a lot of logistics that need to be taken into account. And I think really sitting down and understanding how you're going to handle the logistics of whether it's first dose, second dose, scheduling, you know, submission to the VIS, all of those things, that's really critical before you attempt to administer that first vaccine in order to make sure that you're successful. So I think there's just a lot of logistical planning, and you know, if you've not started that in preparation for vaccines, today's probably the day you need to start that. I think from a patient messaging perspective, I think, you know, accurate, actionable information and frequent communication to whether it's your team members or whether it's a community is important, you know, because it is a very shifting landscape. You know, having somebody that's a point person to keep up with what the current information is at the federal and state level and make sure you update those tools is important, so that our community has the information they need to make good decisions.
Awesome. Leslie, how about you? What would be your one piece of advice for people to be more successful?
Follow what Cindy just said. No, no, I really, if COVID taught us anything, one is, you know, just nothing is as hard. It all seems overwhelming, but we are resilient because of what we've gone through this past year. So I think just, yes, you absolutely need a plan. So, and figure that out. And it will not be as overwhelming as you think it is. There are plenty of people out there. I mean, Cindy and I are here today that we want to do the right thing. We need to get this vaccine out. We need to get it into as many people as possible. But so I think just absolutely do something, right? If this is, you're gonna, more than likely, you're not on here today if you're not planning on giving the COVID vaccine. So definitely get started. And I do completely agree with, if we're going to beat vaccine hesitancy in this, we do have to keep giving them the right information, because whoever's loudest kind of wins. So as we talked about already, but you know, hearing everybody else in their ear. So, you know, join in.
Yeah, that's a good point. So I'm going to just give the PACOM CEU info really quickly. People put your questions in. We may go over a minute or two, but we're happy to answer some. If you want that PACOM CEU, the index number is here in this deck, and we will, like I said, be sending this out with a recording. But you can also just hit yes on the exit survey when it asks you if you want that. I would encourage you to complete the exit survey overall. It also will ask you if you'd like more information about how SR Health can help. So when we were talking about all these best practices, we've done a lot of research. We've been around for a very long time. One thing we really know how to do is patient messaging. We deliver over 1 billion messages a year to patients that touch 1 in 4 patients across the US. We really know how to help you get out the surveys, get out the reminders, make sure patients are showing up, follow, connect, all of that. So if you would like to learn more about how we can help you with this process and specifically with those logistics, with getting patients to schedule and show up, just say yes, we'll have somebody follow up. Anyone who fills out the survey gets put in a drawing for AirPods. So if you just fill out the survey to get the AirPods, that's okay. We just love to get that feedback and know exactly, you know, what people thought of this event, what other kinds of information you'd like to see, whether or not you need some help from us or whether or not you'd like the CEU, just let us know. So questions, and I don't want us to go over too long, so we'll just do a couple. Cindy, if there's 1 or 2 resources you would recommend for people to try to stay up to date a little bit better on what's happening with the vaccines, what would you suggest?
Yeah, so I mean, I think I'd probably start with the CDC. They do have a way that you can sign up for notifications when information changes. And so I think that's helpful because, you know, it's really difficult with things moving so quickly to be, you know, checking back on a daily basis, see if something's changed. When you go into the CDC website, there is a way to sign up and get the most up-to-date information emailed to you, much like you do with new VIS forms, if you're familiar with, you know, getting those notifications. So that's probably the #1 thing that I would say in keeping up, because they've got a lot of good resources. Your state may also have a COVID-19 website. I know Virginia does, and it's a pretty good website, but there's not a way for me to get notification of updates. So I think the CDC is sort of my go-to.
Okay. And then I'll start with Cindy and then Leslie. Are you guys sort of proactively sending out messaging saying to patients, you know, like a text message saying, do you want to sign up to get the vaccine when it's ready? Like trying to actually get people to opt in a little bit? Sydney can go first.
Yeah, so, you know, we've got such a big discrepancy between demand and supply right now. Our messaging has been more around preparing for the vaccine, education, really encouraging folks that don't have they may be our patients, but they've not set up the web portal access as far as getting notifications through the MyChart functionality. We've really been encouraging to do that because that is a great way for us to communicate. But what we've been doing, because we don't want to be in a situation where we've got a lot of scheduled visits or huge waiting list and we don't have capacity for, I mean, like one of our federally qualified health centers, they opened up appointments, and for phase 1B, their appointments are now into June. That's not sort of the message we want to send. So we've been more selectively opening by age groups and sending out scheduling tickets. So our general messaging has been the vaccine is coming. Here's where we are. Here's how you prepare. When your group is up, you will be getting specific messaging from us, either an email, outreach by phone for those that don't have electronic means, or through the electronic health record portal, that it's your turn to schedule. So that's been the approach that we've taken to this point.
Okay. So Leslie, how about you? Have you guys been actively sort of saying to people, hey, you can text or call or email this to sign up to get more information kind of approach?
So we had one practice do a test like of a Facebook post to just kind of see how it would respond. I think the biggest concern for all of us that are trying to be good stewards of this is we don't want to be in that situation where we're getting people to line up at the door and we don't have vaccines. So I agree. We're kind of taking the same approach as education, getting people ready, making sure our systems are in place, pushing out, you know, eventually the pre-book kind of questionnaire and make sure that we have all their information correct and we're ready as soon as we do get the vaccine. But definitely taking a cautious approach on that side of it.
Yeah, I can say here in this community, which again is sort of a rural community, we have a system here that's used by the police, largely police and firefighters, to alert people of things like forest fires. called Nixle. I don't know if either of you have used it in your communities, but they use it here for that. And that's actually what they are. So they've been trying to get people signed up on that for years across the entire county for emergency alerts. And they're now using that for COVID vaccine updates and to get people to sign up saying, you know, we'll let you know when your category opens and where you can go to make appointments.
That's a great idea.
And the benefit of that is now they've like tripled the number of people who are getting emergency alerts for things like weather. So they send out, you know, storm warnings, they send out forest fires. There was the hostage situation, oddly, last year where they had to shut down some roads. They used it for that. So that's been a really interesting use case that I think they never predicted would be the thing they would use that for. But it's increasing overall sort of awareness in the community for a lot of things in addition to the vaccine. So that's the one I know about. So I don't want us to go over any further. We're 5 minutes over. So if anyone has any additional questions, please feel free to send those. In fact, I'll go back here to info@srhealth.com, or feel free to connect with us on LinkedIn or Facebook and send questions. We're happy to get you answers. Again, please do fill out that survey on your way out. Let us know what you thought of the webinar and what additional kinds of topics or information would be helpful to you in the next few months, and we'll do a drawing for those AirPods. Thank you so much, Cindy and Leslie, for being here today. I think it was just such great information for everyone who's really, you know, kind of desperate to learn more about how to do a better job of rolling out the vaccine and supporting patients. So we really appreciate you taking the time today.
No problem. Thank you.
Yeah, and thank you everyone for joining us today. I hope we'll see you on events again in the future, and good luck everybody. I know this is going to be a tough time, but we're all in it together, and hopefully we can help each other be more successful. So thank you everyone. Have a great day.
Bye.